I'm Yasunori Ueda, a director of the cardiovascular division at Osaka National Hospital in Osaka, Japan. I've just presented my presentation at the 22nd World Congress on Heart Disease held in Vancouver. My presentation title is How to Predict Long-Term Outcome of New Stent. When we have a new stent, we have to test if the new stent is better than the currently available one. And we usually see their TLR rate at 1 year. However, as you know, their short-term clinical outcome cannot always tell us the long-term outcome. In the comparison between Cypher stent and Endeavor, we had a better outcome for Cypher at 1 year. However, at 5-year follow-up, extremely better outcome was gained for the Endeavor stent. Can we predict the long-term outcome from the imaging studies? From the endoscopic data, Cypher stent had terrible appearance, absence of their near intima, and they're still having ruptured plaque and thrombus at 1 year. About 40% of cases had thrombus at 1 year. On the other hand, the Endeavor stent had better appearance endoscopically, like bare-metal stent. Stent was covered by thick, fibrous white near intima, and stent nor the yellow plaque under it was seen at 1 year. Therefore, we can say that from the endoscopic data that the Endeavor stent would have very stable lesion at 1 year. However, the Cypher stent had terribly thrombogenic lesion at 1 year. We think the Cypher stent would have a bad outcome during the long-term follow-up, and their result was as it is. Therefore, we think the imaging, not only endoscopy, but imaging study is very important to predict the long-term outcome. We performed Death Note study, in which we enrolled patients who had 1 year follow-up endoscopy after drug-eluting stent implantation and followed them up for their clinical outcome coming from their specific stent. The result was that those who had yellow plaque at 1 year at the site had a higher incidence of MACE during about 4 years. Therefore, we can say that their presence of yellow plaque, that means the presence of advanced atherosclerosis at 1 year, have a higher incidence of future event. We believe that their near atherosclerosis or their progression of atherosclerosis is the mechanism for their very late stent failure. So the reduction of for the reduction of the event, we think their anti-atherosclerotic treatment, such as statin treatment, is beneficial. Therefore, we should have a large trial to test if their intensive lipid-lowering treatment can reduce the long-term very late stent failure, including not only thrombosis, but also restenosis. So my major comment or the opinion I'd like to tell you is that not their short-term clinical outcome, but their imaging study, including endoscopy or OCT, or also the pathologic study, is very important to think about the long-term outcome of a new stent. We don't believe so much on their clinical outcome at a short period. Thank you very much.